Knowing the difference between a Medicare HMO and PPO will help you make the best decision for your needs. Before I start, I want to let you know of a common mistake people make when identifying between HMO and PPO. Many people who call me tell me that they have a Medicare PPO plan when actually they have original Medicare with a Medicare supplement. Technically, this is incorrect. I know I'm splitting hairs here a little, but not knowing what I'm about to tell you can keep you from making a big mistake. If you were to call an insurance company directly and told them that you want a Medicare PPO plan, you're technically referring to a Medicare Advantage PPO plan, and they will start selling you a Medicare Advantage PPO when you really want original Medicare with a Medicare supplement. Like I said, I have people all the time tell me they have Medicare PPO and what they have is original Medicare and a Medicare supplement. When you have original Medicare and a Medicare supplement, there is no network. The only thing you need to look for is if the provider you want to see accepts original Medicare, and then it is good to know if they accept Medicare as payment in full, also called Medicare assignment. I have made a video on how to search providers that accept original Medicare and also if they accept Medicare assignment. Should be appearing here in the top right-hand corner. And as always, there is a link in the description of this video. Hi, I'm Duncan, owner here at Trusted Benefits Direct. We are an independent insurance agency. We help those already on Medicare and new to Medicare get the education they need about Medicare to make the best choice for their needs on Medicare supplements, Medicare Advantage, Part D prescription drug plans, dental, vision, and hearing plans, cancer insurance, protecting retirees' retirement, and more. We gain new clients through education and not selling. If you want to call a huge call center or an insurance company directly and be told what to do or be sold, then we are not a good fit for you. If you want an objective point of view on all your options, then we are a great fit for you. Also, if you find value in this video, please do me a favor and like this video. That tells YouTube I'm doing a good job and will suggest to more people like you. I'm trying to put out a lot of great videos to help as many people as possible. And if you like, you can ask me a question in the comments section and I will get back to you as soon as possible, or leave a comment about what you think of this video, even if you dislike it. I can handle the criticism and it will help me make better videos. If you'd like my free service to help you get the info you need to help you decide what Medicare program is best for you, or if you are ready to enroll in a plan, it's easiest to contact me toll-free at 800-910-3382. There is something I would like to mention, and if you have watched my other videos, I am a bit of a broken record on this, but I don't advocate for one type of Medicare over another. Some agents will only provide Medicare supplements, and others will only provide Medicare Advantage. I choose to be an expert at both and allow you to make the best decision for your exact needs. Some agents like to bash Medicare Advantage while attempting to push people into Medicare supplements. Others only tell the positives of Medicare Advantage while ignoring the glaring negatives of Medicare Advantage, in turn pushing you away from Medicare supplements. I tell both sides of the story to the best of my ability to let you make your own decisions. If you want to see why one of my clients moved from Medicare Supplement to Medicare Advantage, here is a card in the top right-hand corner for you to click to take you to that video. The amount of options you have with Medicare is wonderful, but with it comes confusion, and trying to figure out what is the best for you can certainly be very confusing. Now that we know if you have original Medicare that this isn't technically a PPO, let's get into the differences between an HMO and a PPO. When you see HMO and PPO, they are referring to a Medicare Advantage plan. This video is a little advanced about Medicare Advantage. If you need more of a basic overview about Medicare Advantage, click the card above me to be taken to my Medicare Advantage Basics video. Medicare Advantage health insurance plans, they're typically divided into two categories, HMO and PPO. A Medicare Advantage HMO plan is a type of managed care program that includes a network of providers who have agreed to treat people enrolled in the plan. In general, an HMO plan will have lower premiums, deductibles, copays, coinsurance, lower maximum out-of-pocket costs, etc. than a Medicare Advantage PPO plan. The downside, in my opinion, is with a Medicare Advantage HMO plan that you must see a network of providers and get a referral to see a specialist. If you see providers outside of the network, then it's all likely that you're not going to have any coverage. And in regards to emergency zones, there are no networks for emergencies. And some Medicare Advantage plans have emergency coverage up to a certain dollar amount worldwide. When you have an HMO plan, if you want to see a specialist, you will need a referral from your primary care provider. However, as I have said in other videos, to be fair to the Medicare Advantage HMO, there have been more that have become available in the last few years that will allow you to self-refer to an in-network specialist. But as of me making this video right here, there are still not a lot of them. To find out more, please give me a call, 800-910-3382. When you have a Medicare Advantage plan, it is essentially pay as you go. It is very similar to group coverage most of you watching this video have had through employers. There can be a monthly premium, although most of the HMO plans I provide to my clients have a $0 monthly premium, and some also have a Part B premium reduction, also called a give back. Medicare Advantage plans can also have dental, vision, hearing coverage, over-the-counter pharmacy benefits. Heck, one plan I represent will even board your pet if you are in the hospital. You may have seen commercials with a football Hall of Famer touting a Medicare give back or something being free. This is what it is referring to. And just because something has a $0 premium or they claim it is free, remember, even though it is $0, to get that $0, there is usually some trade-off to get it, like a restrictive doctor network. Remember, I don't push Medicare Advantage or Medicare Supplement or vice versa. I have many happy clients on Medicare Advantage and Medicare Supplements because I educate them about the facts and the positives and negatives to all the plans so they can make their best decision. Anyway, besides having a low to $0 monthly premium, they have co-pays for primary and specialist doctor visits, inpatient hospital stays, etc. On the screen now should be seeing a summary of benefits from one of the companies I represent. On this summary is 3 different plans they offer in various counties in Southern California. I've blurred out the name of the plan. They get mad when I use their info like this without their permission, but you can see one of the plans available actually will rebate you back $109 a month for your Part B premium. This plan has many $0 copays for many services, as you can see, and one plan even has a $0 copay for inpatient hospital admission for an unlimited amount of days. Here you can see the maximum out of pocket you would have to pay in medical copays for the year. After you've reached the maximum, then the plan would pay 100% for medical services. You can see this plan in the middle has an $800 maximum out of pocket. That is a quick overview of Medicare Advantage HMO. Now let's look at Medicare Advantage PPO plans. The reason some of my clients elect a PPO over the HMO plan when getting a Medicare Advantage is the provider networks are usually much more expansive. In addition, you don't need to get referrals to specialists. And if you want to see a specialist, you can just make an appointment. Some agents, especially those that work directly for insurance companies or in big call centers, say a PPO plan will allow you to see any provider. There is no network. A PPO plan has providers in and out of network. Usually a PPO plan has much lower co-pays, co-insurance, etc. when seeing an in-network provider. And if you see an out-of-network provider, then it is likely that the out-of-pocket cost you incur will be higher as compared to the in-network providers. But you need to be careful when someone says there is no network for PPO plans. If you see an out-of-network provider, you should be asking if they will accept the plan for payment or bill your plan for payment. If they won't, then you are going to have to be going through the hassles of filing claims directly with the insurance provider. In addition, that provider may perform services that the Medicare Advantage plan does not cover. And any services your Medicare Advantage plan doesn't cover, then you are responsible to pay 100% of those costs. Also, an out-of-network provider may charge, and I'm making up a number here for this example, $1,000 for a service. But the Medicare Advantage plan will only reimburse $500 for that service. You're going to be responsible for the $500 in this case, plus the copay as well. I say this because I want you to be careful if someone tells you that PPOs have no networks and you can see any provider you wish. to make it sound like it's the greatest thing since sliced bread. And agents do that because over 10 years ago, when I started helping with seniors and with Medicare, that is how I was trained. But it didn't take me long to figure out presenting something that way isn't the best way to educate someone, or more importantly, the best way to run a business. And in my opinion, it is best to seek out in-network providers if at all possible, because they have already agreed to accept the plan for payment and have accepted what the plan will reimburse them. If you want to see an out-of-network provider, I would call them and see if they accept your Medicare Advantage plan and what the charges are for the services, and contact your Medicare Advantage plan and see beforehand what your costs will be. Since I have showed you some of the costs for a Medicare Advantage HMO, I'd like to look at PPO here. You can see here the monthly premium is $89 per month, and there is certainly no Part B premium giveback. Here is what I was talking about with the potential costs being higher for seeing in and out-of-network providers. You can see the deductible for seeing an in-network provider is $0, and the deductible for seeing an out-of-network provider is $750. The maximum out-of-pocket costs are also higher with out-of-network providers. You can see here in-network is $7,550 and the out-of-network is $11,300. The in-network inpatient hospital copay for in-network is $395 for the first 5 days. You can see the out-of-network hospital stay is 40% after you pay the deductible. In-network primary physician copay is $10 and specialist is $40, and an out-of-network doctor is 40%. These are just a couple of examples. I don't have a lot of clients on Medicare Advantage PPO plans, and the reason being is once someone looks at the costs, it just starts to make more sense to stay with original Medicare and get a good quality Medicare supplement. If you want more information, give me a call and we can see what is available in your area. Again, my phone number, 800-910-3382. Now, before I end this video, and I try to keep these as brief as possible, but I know my videos are not short, but there is a lot of info to get through. I get asked what are the health qualifications to get in a Medicare Advantage plan. I also get asked if the health questions are different for an HMO and a PPO. The answer is simple. Medicare Advantage plans cannot deny you coverage or place any pre-existing clauses on any services. To qualify, you just must live in the plan service area and have Parts A and B of Medicare. Now I get asked this question a lot. If I have a Medicare Advantage, do I still need to pay the Part B premium? The answer is yes. We know old Uncle Sam isn't going to miss out on any money. Even if you have a $0 monthly premium Medicare Advantage plan, you must always pay your Part B premium. Okay, that takes us to the end of what I hope you think is another great Medicare video. Let's go through the quick recap. Remember that original Medicare with a Medicare Supplement is not a PPO. The only network, so to speak, for original Medicare is if the provider you see accepts Medicare. Next, a Medicare Advantage HMO can be very restrictive. If you see a provider out of the network, you are highly likely not to have any coverage. In general, you need referrals to see a specialist, but there are a few plans that let you self-refer. The deductibles, copays, coinsurance, maximum out-of-pocket, etc., in general is the lowest on HMO plans. PPO plans allow you to have coverage in and out of network, but be careful when seeing out-of-network providers. They may not accept the plan as payment, leaving you filing claims on your own. Also, what the plan pays and what the provider charges could be different, leaving you on the hook for the balance. PPO plans network of in-network providers is usually very extensive when compared to an HMO plan. Also, the premiums, deductibles, copays, coinsurance, max out-of-pocket, etc. are in general higher than the HMOs. Also, when comparing costs between in and out of network coverage for a PPO plan, the out-of-network deductible, copays, coinsurances, etc. are generally higher. Again, I'm Chris Duncan. If you have a question about this or anything else, I'm here to help. I help with Medicare supplements, Medicare Advantage, Part D prescription plans, dental, vision, hearing plans, final expense life insurance, also called burial insurance, cancer insurance, protecting retirement savings, and more. If you'd like my free help or you are ready to enroll in a plan, it is easiest to contact me toll-free at 800-910-3382. If you found this video helpful, and it likely is if you made it all the way to the end, please give this video a like. Subscribe to my YouTube channel and like my Facebook page as well. This way you are notified when I put out new videos and blogs. If you like, you can ask me a question in the comment section and I will get back to you as soon as possible. Or leave a comment about what you thought of the video. Even if you disliked it, I'll be able to handle the criticism and it will help me make better videos. Thanks for watching, and I'll be seeing you soon in my next video.